The United States is reporting its second case of Ebola. The healthcare worker had treated the nation's first Ebola patient, Thomas Eric Duncan, and she became infected. Duncan died at a Dallas hospital last week after he contracted Ebola in Liberia and traveled to the United States.
This is exactly what U.S. authorities feared, the first case to be transmitted inside the United States, and that's in spite of all the precautions put in place. What is perhaps most alarming about this case is that health officials say the now infected nurse was wearing full protective gear when she treated Thomas Eric Duncan for Ebola. She was also not one of the 48 people who are being monitored after coming into contact with him. The nurse first treated Duncan on his second visit to the hospital when he was admitted on September the 28th. Duncan was confirmed to have Ebola 2 days later. Health officials aren't exactly saying what happened, but saying there was a breach in the strict protocols in place when treating patients with Ebola, that other healthcare workers will now be checked.
We're still determining how many healthcare workers that will be. That is an intensive investigation. It takes many hours of tracing steps. We'll always cast the net wider. There, though, is no risk to people outside of that circle.
According to the Centers for Disease Control and Prevention, or CDC, the nurse was self-monitoring her temperature at home for 2 days. In a statement, the hospital says she reported a fever and within 90 minutes was isolated immediately upon her arrival. Ebola can only be spread once carriers start to show symptoms, and it seems the nurse came into contact with one other person during that period. That person has now been isolated. This is worrying everyone from local Texas health officials to the President of the United States, who called his top healthcare official to make sure the investigation into what happened is conducted with the utmost urgency.
We will also undertake a thorough investigation to understand how this may have happened, and we will ramp up infection control to do whatever we can to minimize the risk that there would be any future infections.
Testing does show that this healthcare worker does have a lower level of the Ebola virus in her system than Thomas Eric Duncan. But the fact that she contracted it in the first place is a further stain on the character of the hospital, the Dallas Presbyterian Hospital, which of course turned away Thomas Eric Duncan when he had a fever of 103 degrees. Nathan King, CCTV, Washington.